Hi guys, it's Maggie and I am back today, and in today's video I thought it might be interesting to talk about one-piece ostomy changes as somebody who's had their stoma for well over a decade and also was inspired to go into nursing, worked bedside GI nursing as well as working for an ostomy telehealth company. I thought it might be kind of cool to talk about the perspective of the patient as well as the nurse. You may notice here that I am wearing a two-piece system currently, but I'm going to be switching over to Convatec's Esteem Body one-piece ostomy pouch. They are so kindly sponsoring this video, so before we get into the actual change, let's talk about some of the really unique and neat features of this ostomy system. The Esteem Body with leak defense really has two primary features to it. It starts with the adhesive that creates a strong barrier that adheres well and protects the skin, and then it also has soft convexity. So for those of you with retracted or flush stomas, this is a huge benefit. It puts a little bit of tension around the stoma and it really helps it conform to the shape of your body. You may have noticed the modern fabric here, which is water repellent and also just ultra chic. It has a nice little viewing window, so the fabric itself you cannot see through even when wet, but when you need to get a look at the stoma, you are able to do so. And that fabric remaining opaque, whether it's wet or dry, is so important to the confidence of the patient. The figure 8 shape of it is a specific design. It's done on purpose to help prevent sagging and bulging, which is really what makes the ostomy appear more under clothing when it starts to fill. And emptying for me was a breeze. The end was so easy to pop open, get it really thoroughly clean, and close it back up again with the Velcro closure. You'll see more of this system throughout the video as I go through my ostomy change, but if you're interested in ordering a free sample, you can head to the link in my description below. So both two-piece systems and one-piece systems have their own benefits. There's one thing though that I really want to share about one-pieces that was extremely impactful to me as a brand new patient. When I first received my stoma, I was fairly underweight, and because of that, my stoma was almost in a valley in my abdomen. My hip sort of poked out, and it was really hard to conform an ostomy system to fit into there. Thankfully, my hospital put me into a one-piece ostomy system. It was actually by Convatec, and I think they did that on purpose because with one-pieces, they tend to be a bit more flexible. If you think about a two-piece system, most of them connect through a rigid ring. You know, you've got the rigid ring of the bag, a rigid ring of the flange, and they connect together to click. If you have that, it makes it so the flange is not as bendable, as flexible. A one-piece can much more easily fit into areas that might not be perfectly flat, and that's exactly what I experienced, and a one-piece worked really well for me as I was, starting to heal from surgery and gain weight again. That's something you want to keep in mind if you're caring for somebody with a stoma or you yourself are living with one that might be in an area that's just not the flattest. So, in moving forward into the ostomy change, it's really important to protect the clothing, and this is also really important for the dignity of the person living with the stoma. At home, I just use a little bit of a paper towel here and tuck it into my pants. If you are in the hospital, it might be better to use something like a chuck because the backside of them does not allow any liquid to permeate through it, therefore getting on your clothes. Because I know my stoma fairly well, it feels like it's being quiet. Let's hope it is. I think I should be okay with just a paper towel, but I of course put some extra to the side here in case there's any explosions. It's necessary for the person living with the stoma to understand there isn't a muscle anymore to control bowel movements. You'll have output whenever your intestines really decide, that it's gonna happen. So that's why it's so necessary to not just protect the clothing of the person, but also the dignity. Don't make them feel ashamed because of something they have no control over. In the hospital, as a caregiver or a nurse, you'll want to wear gloves, but because I'm in the home setting, this is my stoma, I'm not going to wear gloves, just like people who are wiping themselves or changing a diaper don't wear gloves. Just remember to practice good hand hygiene. Before removing the old appliance here, you want to prepare everything that you'll need ahead of time. That means you want to prepare the new ostomy appliance, you want to get the opening cut to the appropriate size, and this means cutting it as close as possible to the size of the stoma so that when you place it on, there is no skin showing. That can cause leaks, that can cause irritation. Not all stomas are perfectly round either, so you want to accommodate any areas that either deviate outwards or deviate inwards. You want to mirror it as best as possible when cutting the flange. Along with ensuring that the new appliance is cut appropriately for the stoma size, I've personally set aside some adhesive remover. I find that super helpful in not just removing the bag, but cleaning the skin very thoroughly. Some skin barrier spray, some skin barrier wipes, and a little bit of stoma powder. If you choose to use something like a barrier ring or paste, you want to get that prepared as well. It might be the time to put that onto the actual ostomy appliance, or if you prefer to put it directly on the skin, we'll do that after we prepare the skin. If you have any sort of receptacle bag that you can dispose of the old appliance in, it's really helpful to keep on hand. In fact, I like to tuck the end of my ostomy into it and pull it off directly in there. It's the way that I have minimal mess. And I am just very carefully and very slowly going to peel off the old appliance. This is when an adhesive remover spray can be really helpful, especially with a person who may have a brand new stoma. That skin can be really raw, and peeling off an ostomy appliance can be quite painful. It's absolutely necessary to get the skin as clean as you possibly can. This is what optimizes the next ostomy system, really makes it adhere well, and makes it stick to the skin for a longer period of time. Now you may notice that if you use a barrier ring or a barrier paste, that there's going to be residue. Oftentimes that happens, and that can be a little bit painful to remove from a new stoma. I try to either peel it off in one piece if I can, if it's still fairly intact. If that doesn't work, adhesive remover wipes really help a lot. And if you don't have those on hand, soaking a bit of paper towel or a cloth in warm water and letting it sit on that paste and kind of help it congeal a bit more and then remove it, that can make it a little less painful as well. But for me, I'm just trying to peel it up as best as I can because fortunately I don't have any pain around my stoma. Once I've removed a majority of the residue, I'm going to go in with my adhesive remover wipe. This is something that I recommend to every patient. It's not always accessible in the hospital. Hospitals don't often carry ostomy specific adhesive removers. You don't want to use just regular adhesive remover because they tend to be fairly oily and they leave this residue that just makes it so the next system won't stick as well. But these are extremely helpful in just getting the rest of everything off the skin so we can have a nice clean surface. Once you've cleaned the skin, it's time to prepare it. That might include using something like a stoma powder if you notice any irritation around the stoma. For myself, I'm noticing just a small area of irritation right next to the stoma, so I'm going to put an extremely light layer of this, just gently testing it on my hand first to make sure the powder's coming out and it doesn't come out fast, and just spritzing a small amount. Now, inevitably, you're gonna put too much on. That's how these bottles work. So I like to tap the bottle, get the air back to the top, and then use it as like a little air squirter that helps to brush away all the excess powder. If you've got too much powder on there, it makes it so the next system is gonna have trouble sticking. Now, nothing sticks to powder, so you wanna make sure to seal it in with a skin barrier. A lot of the times in the hospital, it's usually a wipe or a little wand that you have for skin barrier. I have a spray. It's a little bit more convenient, covers a little bit more evenly, but if you do have a wipe or a wand, just gently press over the stoma powder to really set it into place. I'm just gonna do that. All right. You may notice, and I may jinx myself here, but my stoma is pretty well behaved during this change. I have learned over time how my stoma reacts when I eat and when I'm hungry, so I kind of aim in between meals when, you know, I've already had a bit of output, it slows down a bit. That's when I aim to change, and that's something that a person living with a stoma will learn over time. There's also the trick of eating a marshmallow or two to help slow the output. I don't like marshmallows, so that's why I just time it. I feel it. I feel when my stoma's active. I feel when it's quiet, and I try to do my bag changes when it's quiet. And thankfully, I chose the right time right now. You'll want to wait a minute or two just to make sure that the skin is completely dry after placing that skin barrier on before moving on to the next step. And if you start to notice that the stoma is becoming active, you can always take another piece of paper towel or whatever you've got handy. I like to fold it a couple of times to make sure it's a little bit stiffer, and then I will actually just wrap the stoma. This can be a little bit more difficult if it's a flush stoma or a retracted stoma. There are different tools out there to help with that, but in this instance, we're just using a little paper towel. Now that my skin is completely dry, it's time to place on the new appliance. And if you're using a barrier ring or paste and you did not put it directly onto the pouch and you're putting it onto the skin, you can then go ahead and place that. Now you may notice, because this is soft convexity and I do not have a flush stoma, I'm very fortunate in that my stoma does kind of protrude a little bit. I am going to skip the step of a barrier ring because this provides pretty good pressure around my stoma to, you know, put that tension around it. So let's put this guy on. Something really important to remember with a one piece as opposed to a two piece is that you cannot reposition the bag once it's on. And oftentimes in the hospital, as a nurse, I am guilty of this. I will place the ostomy bag on a diagonal because when the person is laying in bed, it's a bit easier to empty an ostomy that's hanging over their side. But if the person living with the stoma is able to empty their ostomy on their own, it's a little bit easier to make sure that the portion that empties is facing downward. Another thing about one piece versus two piece is that with a two-piece system, you can place the flange on independently of the bag, which is really helpful if you're trying to aim the stoma through the opening and you can't quite see it. Being able to just have the flange on there without the bag, you can see it fairly easily. With a one piece, you do not have that option. Fortunately, with this system, there is that peak window. So what I am going to do to make sure that I'm aiming in the right spot is I'm going to open that window and look through it as I place it over my stoma. That way, I know that my stoma made it through it. You'll want to press right around the stoma to make sure that it's adhering well, and then you can move your hands outward, provide a little bit of warmth. That helps it adhere better as well. And then obviously, I think the most important step here is to ensure that the end of the pouch is closed. I have, unfortunately, very early on in my ostomy journey, a nurse forgot to close the end of my pouch and it left me mortified when I got out of bed, and it went everywhere. With this one-piece system here, that I cannot do is I cannot burp the bag. If you're unfamiliar with that, it's usually with a two-piece system. You'll just disconnect the top of the bag from the flange just a little bit to press out any gas. You're unable to do that with a one-piece, obviously, because you wouldn't have anything to deattach. But I will say, in wearing this ostomy bag, the filter is extremely effective, and that can be wonderful. Any ostomy system with a filter for somebody who has a bit of that gas buildup can be very helpful. And that is changing a one-piece system. You know, it really isn't that different from changing a two-piece system, but there are a couple of things to consider. If you're interested in this awesome ostomy appliance, I just think it's so cool. I'm so excited about it. Make sure to order a free sample in the link in my description. I really appreciate Convatec sponsoring this video and really just, you know, making such a neat ostomy system that you know they're listening to the patients. It's very clear about that. All right, guys, thank you so much for watching. I hope that you enjoyed this video, and I'll see you in the next. Thank you so much for watching today's video. If you are looking for a way to help support my channel, consider liking this video or even subscribing. You can also check out my store at LetsTalkIBD.shop. I have stickers and hoodies like these guys over here, just related to chronic illness and inflammatory bowel disease, something fun. And I also have a coupon code for my YouTube watchers. You could also become a member of my channel like the wonderful people scrolling on screen here. They've become a member and they have access to videos a little bit earlier. It's a great way to support my channel, and really, just watching my videos means the world. Thank you so much, and I'll see you in the next.